The question here, a nurse is assigned to an adolescent. Which nursing diagnosis is most appropriate for a hospitalized adolescent? So, number one, anxiety related to separation for the parents, fear related to unknown, and fear related to altered body image. And for ineffective coping related to the activities restriction. So adolescents group is very concerned about their looks, right? So anxiety related to the separation, this is not for the adolescents. It is for infant who is 1 or 2 years old. Fear related to the unknown, it is also for very young infant or children, not for adolescents. Ineffective coping related to activity restriction, it is very important, number 4, but adolescents grow more concerned about their body image, how they look like. 3 and 4 both is important, but number 3 is priority, first come in their mind. So what is the rationale? Fear related to altered body image is the most appropriate nursing diagnosis for a hospitalized adolescents because of adolescents' developmental level and concern for physical appearance. And adolescents may fear disfigurement and resulting from produce and treatment. Separation is uncommon in major stressor for the adolescents. Eliminating a diagnosis of anxiety related to separation from parents, it is also uncommon for adolescents. Adolescents may have a fear related to unknown, but they typically ask the question if they want some information about it. Diagnosis of ineffective coping related to activity restriction may be appropriate for toddlers who are difficult to tolerate the activities, right? And also restriction, but unknown here. But I said this is which one is more common for adolescents group. We must figure it out, right? Keep in mind, the person who is more than 7 years old or 12 to 18 years old, we call adolescents or teenager group. Give them some space because internalization is important. In this age group, they like to make a peer association, and self-development is important, right? It is very important to know. Next question, let me see. A nurse is caring for an adolescent who underwent surgery for perforated appendix. So appendix is the inflammation of appendicitis. Inflammation of appendix we call appendicitis. When caring for these adolescents, the nurse should keep in mind that the main life stage task for adolescents is what? So I said a patient who is around 18 years old, 15 years old, or teenager, when they got hospitalized for any medical condition like inflammation of the appendix, we call appendicitis, patient need surgically remove the appendix, right? When caring these adolescents, the nurse should keep in mind that the main life stage tasks for adolescents is what? Number one, resolve conflict with parents. Number two, develop an identity and independence, development trust, and plan for the future. My friend, there are four options. Number one is personal issues. And this is not related to this question what examiner asks. Number four, also it is not your concern to build a future for your patient. Number two and number four is important. Development a trust. It is very important to make a trust with your patient. Then they can verbalize their feelings, right? But keep in mind, this patient is med-surg. Patient is going for surgical operation. This is not absolute psychological patient. Make a trustable relationship is very important, priority for the patient. But when you read this question is important identification, because patient is going under a surgery to remove something from the body. So development and identity, personal identity and independence is important in this age group. As I told you, in teenager age group, it is very important to internalization or self-development is important here, right? We give them priority to this. And let me read their rationale. And adolescence, for a sense of independence or identity, it is the priorities. Because of this age group, during this time, the conflict are highlighted and not resolved. Trust began to develop during infancy, means when patient is very young, like 6 to 9 months, 9 to 12 months, 1 to 3 years, it is the first important to make a trust, make them comfortable, feeling good to verbalize their feelings, right? Also mature during the course of development. Adolescence, it is very uncommon to finalize the plan for the future. You do not need to do this. And this normally happen later in adulthood. So in this question, the priority is develop identity and independency. So when we study the age-related activities, it can help to better understanding. Next question here. A nurse is caring for 19 months old infant, right? 19 months. So in this group, basically 1 to 3 years age group in between. An infant with dehydration and weight loss, very dangerous in this age group, dehydration, because dehydration shock, hypovolemia and hypovolemic shock. If you do not care of them, they will, they will die. But if you give them some fluid, rehydrated, you can prevent the danger. The infant mother stated that her son does not like to eat, and that she hate to make him eat. The nurse should what do, my friend? The infant or very young children, they do not say, I have this, I have that. They does not say about their complaint. But as a parents, as a pediatrician, as a healthcare provider, we have to see, and then we have to understand what are the underlying cause. If baby or infant is do not eat, refuse to eat, or crying, it indicate they are sick, right? So infant mother state that her son does not eat and she hate to make him eat. Oh, mother is not good, right? So the nurse said, what nurse should do? Contact the social worker and duty and give her information about the situation. This is good choice, right, my friend? But it is very early to talk to the social worker. You do not see any absolute sign to abuse the baby. Contact the physician to have the child put in isolation. Patient is dehydrated, nothing related to infection, airborne disease. They need to isolate first. No fever, no sign of infection. Request that a dietitian talk with the parents about the infant and nutrition. So talk to the dietitian, talk to the counselor, then maybe parents can motivate it, or dietitian can find out what are the underlying cause my patient do not eat. Or first of all, dehydrated patient, we try to rehydrate it. Take the medical steps. Contact the local police department. It is why number 3 is answer. Why? Why? Answer, because number 1 is not an answer. It is very early to talk to social worker. Number 2, patient do not have any infection. I need to isolate them. I do isolate if patient is an airborne disease like pneumonia, like tuberculosis, measles, right? And number 4, also nothing happened, need to talk to the police. So my answer is 3. 3 is closer, right? But if any option like patient need to rehydrate it, that should be the priorities. But rehydrate related, no answer is there. So rational. The infant mother needs assistance in maintaining her child diet, requesting that a dietitian speaks with the mother about the child diet in within the mother's scope of practice. The nurse should not call to the local police or social worker on duty because there is no evidence of child abuse or negligence. And many infants are picky to eater and also choose not to eat or drink. It is not uncommon, right? There's so many babies does not like to eat, and the nurse does not need to call to the physician to have the infant put in a isolation. Isolation is not indicate for dehydration. A nurse is prepared a discharge teaching plan for a client with the atopic dermatitis, right? This is the disease, skin problem. Which instruction should the nurse include in her teaching plan? So patient atopic dermatitis, what is the important for this patient? Wear only synthetic fabrics or use a topical skin moisture daily, and also bath only 3 times per week, and also keep thermostat above the 75 degree Fahrenheit. So there are 4 options. So which one is better fit with this? Right? So first of all, I could tell you, as a healthcare provider, particularly LPN or RN, we always look for non-pharmacological management. If non-pharmacological management is not enough, talk to the healthcare provider or physician for medication and go for pharmacological management. In this question about atopic dermatitis, also called eczema, atopic dermatitis usually develop in early childhood, and it is more common in the people who have a family history of the condition, right? So first of all, we try to non-pharmacological management and moisture, because the patient have a dryness in the skin, itching, and dry scaly skin. So if you put moisture, then it is better for prevent to make worse. 3 per week, keep thermostat above. It does not mean any related to this. So what are the rationale? The nurse should instruct the client to use a topical cream moisture daily to keep the skin hydrated. Likewise, the client should be encouraged to bath daily. Also minimize the irritation. The client should wear only cotton fabrics, not synthetic. The client should maintain a room temperature between 68 degree Fahrenheit to 72 degree Fahrenheit. What next? A nurse is reviewing an adolescent's immunization record. Which immunization appropriate is immunization is inappropriate for an adolescent is a component of preventing care. So in this question, there are 4 options. What should be our answer, right? So about the immunization, here we go, and here we supposed to talk about. So what are the first option here? So they said a tetanus diphtheria vaccine, or we give tetanus diphtheria, it is shortly called TD vaccine, given 7 years after the most recent childhood diphtheria, tetanus toxoid. A second measles, mumps, rubella vaccine, a tuberculin skin test every other year, and also hepatitis B vaccine. So this question, which immunization is inappropriate for adolescents as a component of preventive care. So basically, we like first question, tetanus diphtheria, TD. Tetanus vaccine or diphtheria, tetanus or pertussis, we give second, 4 and 6 month of age group, right? And then we can give 18 month, nothing related for adolescents. And last, and here hepatitis B vaccine, hepatitis B we give during the birth time, or we can give first month or second month of life, or we can give during the 6th month, nothing related to adolescence, hepatitis B, right? So something is important I want to tell you here with you. DTaP or diphtheria vaccine or vaccine for diphtheria, tetanus and pertussis, total 5 doses we give, right? Total 5 doses. And hepatitis B, number 4 here, before to give, must check the yeast allergy to the patient. If they have yeast allergy, we never ever give. Like another information, MMR vaccine, measles, mumps, rubella, before to give, check for the egg allergies. And do not get the pregnant within 3 months after MMR vaccine. So why? They said a second measles, mumps, and rubella vaccine during the adolescence. This is the answer, right? Why this is the answer? Because MMR vaccine we give first dose, usually we give 12 months, and second dose we usually give after 4 to 6 years. It is related to the adolescence age group, right? And also, as I told you, before give MMR or measles, mumps, rubella vaccine, must check for egg allergy first, and maybe combined, or we can give separately, and educate your patient, do not get pregnant within 3 months. What is their rationale? A second MMR vaccine is a recommended immunization for an adolescents. And tetanus diphtheria vaccine is given 10 years after the first most recent childhood DTaP vaccine. DTaP means diphtheria tetanus vaccine. Hepatitis B vaccine is recommended only if the adolescent has not received one either. A tuberculin skin test is necessary for adolescents who have been exposed to active tuberculosis and have lived in a homeless shelter. So this is important. And let me finish this question. Have been in cancelled or have lived in or come from area with a high prevalence of TB. So keep in mind, TB prevalence or incidence is more common in low socio-economical population, low income population, overcrowded population. But TB also common in the developed country because of HIV, right? So what next?